Hello, Alison St. Germain. I'm a registered dietitian for Iowa State University with student health and wellness, and I specialize in eating disorders and body and food relationships. And so this is just a continuation on of the little series that I'm doing. And today we are going to talk about BMI under the microscope, why it fails as a health metric. And this is one of my favorite things to talk about because there's a lot of controversy around it. So it's kind of fun to really get into it. So we're going to look at its history and its limitations because it's intended to measure body composition, which it does a really bad job of. And then also it's just been like so if your body comp is high in fat, that automatically is a measure of health. So there's some inappropriate ways that it's being used. And then, again, working together as a team so we can inform our students and look at their health in a holistic and equitable way. And so basically what I want you to get out of this whole video is that, and you know this already, but we all continue to use BMI. It's outdated, it's oversimplified, and it can cause harm. So the origin of BMI is pretty cool, pretty interesting. It goes all the way back to the 1830s, in fact, and it was created by a mathematician who was doing research, but the purpose of his research was not looking at indicators of health. He was just categorizing people. And so now he was a mathematician, not a physician or any type of healthcare professional. So also he was looking at populations, not individuals. And in healthcare today, it's used very widely for looking at individuals. And it was not and is not intended as a measurement of health. And so the interesting thing was at some point, the life insurance companies grabbed onto it and have used it to deny coverage and to increase premiums, unfortunately. And actually, up until just, before the Affordable Care Act, BMI was used as if it was in the obese category, that was used as a pre-existing condition. So people were then denied health care because of their BMI. That's changed now, thank goodness, but it hasn't been that long ago that was going on. So anyway, I don't know if y'all remember this. I remember this, probably how people remember, when people were on the moon for the first time. I remember when the categories for BMI were changed. It was in 1998. And overnight, millions of Americans, 29 in fact, became overweight or obese. And so the interesting piece of this, and I have the reference right here, I also have it at the end of the slides too, is that there was a self-appointed committee that got together and recommended to the NIH that the BMI categories should be lowered. And so, which means that more people would fall into the overweight and obese categories. And 7 of the 9 people on the self-appointed committee had ties to the weight loss industry. And the chairperson was a former executive director and current board member of Weight Watchers. So was it a coincidence or not that overnight they had more people to qualify for their program? I'll let you decide that. I'm just stating the facts here. So it's kind of sketchy about how those categories were changed. And so we all know this already, that BMI has some major limitations to it. Number one, it can't distinguish between fat and muscle and bone, and it misclassifies people all of the time. And also, by doing this measurement, we can't tell if it's visceral fat or subcutaneous fat. And those types of fats have different health effects. So 2 people can be of the very same BMI and have different health risks, but it would be missed because we're looking at such a simplified, outdated measure. And so then also it has racial and ethnic bias as well, because BMI was actually how it all came about. It was used with European white men, which it's not even a good measure for them. Yet it's then like put on to people of all races as to what the perfect healthy BMI should be. It also has gender and age limitations to it. Body composition changes as we age. Women and men have different body compositions as well. And I already told you about the healthcare being denied to higher weight people pre-Affordable Care Act. And then also medical misdiagnosis or oversight can happen because people are labeled healthy or unhealthy just by this measure. And so our vision becomes clouded with a person's weight or their BMI. Then, of course, and we've already talked about this in previous videos, the stigma and the weight bias that ensues, especially in healthcare, which is really problematic because treatment can be delayed or missed. And then, of course, we have the policy issues, which we touched on earlier as well. So some alternatives to BMI would be the waist circumference or the waist to hip ratio or the DEXA. And so this will give more accurate information than BMI to body composition. However, it's still problematic when we're trying to put this one measure on somebody's health, right? We can't reduce health to a single number or a single looking at just one thing. And so, because this is not accounting either for diet, exercise, mental health, stress, metabolic markers, that sort of thing. So, although it is a better measure of body composition than BMI, that's it. That's pretty much it. It doesn't help as an indicator of health. So instead, this is what is best. Holistic assessment is best. So instead of body composition, looking at metabolic markers and other assessments is going to give a way better indicator of health. We can't reduce it just to one thing. And so we can look at blood pressure, glucose, lipids, fitness level, mental health, lifestyle like substance use or stress, their nourishment, and then also social determinants of health. So we might not have all of that information at our access, but if we can use all of the things that we have available, we're going to have a better indicator of somebody's health and be able to help and guide them better. So the call to action is to look at each individual holistically and not hyper-focus on one or two things. And students will hyper-focus on one or two things. So that's where we need to kind of jump in and guide them and help them see the big picture. And then discuss with them that BMI is not a good measure of health and why. And then also explore what methods are better indicators of health. And then advocate for more comprehensive and equitable measures for health. And then challenge the weight-based assumptions in clinical settings. Okay, so this is basically where we started. BMI is outdated, it's oversimplified, and if it's used as an indicator of health, can cause harm. And here are the fun resources I put together for you all and for the students. There's a podcast here. There are research articles. There's a short clip on here, a little video to watch as well. Okay, thank you for listening.